Pandemic Relief Fund. Could somebody do something?
I think a lot of people are signing on, so everyone just needs to mute their lines.
Okay. Before we start, as I mentioned, this is the second of our Fundser briefing series. And before we start, I just want to remind everyone that we have a whole array of programs and services that we've organized since the COVID virus has become a center issue for us. And if you go into our website, you will find a one-stop area that you can get all kinds of information, resources, articles of interest on this particular subject, and we are updating this regularly. Okay, then. So today we've been covering the funds that are available that have been created to help in this particular situation that we have in the state. And today we have with us Josh Weinrich, who's CEO of the newly formed New Jersey Pandemic Relief Fund. And also with him is our own Hans Decker, president of the Community Foundation of New Jersey, which is serving as the conduit for the resources of this latest relief fund. So with those updates and that introduction, I'm going to pass it on to Josh now to begin their presentation.
Actually, Maria, this is Hans. I'm going to start off and then hand it to Josh.
Okay, perfect.
And thank you guys. Thanks everybody for being on the call, and thank you, Maria, for all the work you're doing. I remember too well how critical the council was after Sandy, and there are a lot of parallels to what we're going through today as to what we went through with Sandy. And you know, one of them, I think, and for folks that were involved in the relief effort and the recovery effort after Sandy, there's this sort of weird mix of urgency and time pressure, and then a need to sort of be patient and thoughtful at the same time. And I think that's the approach we're trying to take with the relief fund, is to move as quickly as we can. But, you know, we've really been at this for less than 2 weeks. And so we're trying to be as thoughtful and deliberate while also recognizing the sort of pressing needs on our community. So Anna, if you would take us to the first substantive slide, that would be great. So in broad strokes, you know, like a lot of the relief efforts, and we're going to touch in the end about how we can partner with the other relief efforts that are going on. But you know, what we're trying to do very simply is gather private resources that we hope can fill gaps in the relief effort and leverage, you know, sort of be a spark for leverage where it can. I think one of the challenging things about using philanthropy in this kind of environment is, as everybody knows, there's a lot of federal resources coming, there are a lot of state resources coming, there's a lot of local resources being created, and thinking about how private funding, sorry, my phone is ringing, thinking about how private funding can work in that environment is hard. And so we're really trying to be conscious of how we work in concert with both the federal and state resources, as well as the local resources that are being created. So the way we think about the work is first, what can we do on the in-kind side? Can we, you know, we have some celebrity PSAs, we've been rolling them out over the last 10 days that are not only encouraging people to give, but also reinforcing the social distancing message. You know, there are lots of folks offering in-kind resources, whether it's personal protective equipment, whether it's laptops for schools, and we hope the fund can be a conduit for that information and matching that don't necessarily require dollars, but require a clearinghouse, if you will. As I alluded to, the First Lady, Tammy Murphy, is the chair of the fund. And as a result, we, I think, have really good access to how the state and the feds are thinking about some of the resources they're providing. And I think it'll help us as things unfold be as smart as we can about where we deploy our resources. We really want to coordinate with local relief efforts. I know there are a number of them on the phone, and I'm not trying to omit folks, but there's one in Bergen County. There's the United Way's Good Work in Newark. My colleague Andy has launched a fund for South Jersey. My colleague Jeff has launched one for the central New Jersey area. And I noticed Maria invited folks to participate in a how do we collaborate call in the coming days. And we're really looking forward to that. There are, as everyone knows on this call, the needs will be unprecedented. And so the need to work carefully together will be unprecedented as well. And then lastly, and not least, obviously, is can we provide some grants around critical needs in the community? Can we go to the next slide, Anna? So along those lines, we're building a board. As Maria said, the Community Foundation is hosting this. We have a mechanic that we've used in other instances where we kind of create a separate board under our umbrella that has roughly the autonomy over the fund. In this case, it's chaired by Tammy Murphy, has a number of founding people on it, but we're hoping to continue to build the board over the next few weeks to sort of garner the kind of expertise and frankly resources that we need to make this successful. And we're trying to build the structure. So just like any nonprofit board, how do we think about who's going to be on our board and committees? How do we think about giving the money away and what the recovery looks like? How do we garner the assets that we need to? How do we use the pulpit of the fund to encourage the kind of human behavior, and how do we use communications to do that? And then how do we interact with the healthcare system in a way that helps leverage what's going on in the healthcare system? Next slide, please, Anna. So I'm going to turn it over to Josh. Josh is the CEO. He's been kind enough to volunteer his time to do this. And it's roughly about 20 hours a day that he's been working. And so I'll ask Josh just to talk about how we're thinking about our objectives and the work.
Thanks, Hans. And hello, everybody, and thank you for having us. And I'm delighted to talk a little bit about our approach and what we're doing. It's, goes without saying that the scale of this problem is, unprecedented. And we recognize that, whatever funds we are able to raise are going to be small in proportion to the size of the problem. And it's a reason why we really are looking for ways to be highly leveraged in terms of the impact we can accomplish per dollar, but also through relationships and using resources. Hans, touched on it, but we really think we have a great vantage point because we have great information and connection, we think, to federal and state resources and information. And with our board and our foundations, we have a really good connection to the local relief efforts. And so I think having the ability to be a little detached, because we're not, either one of those, but are able to make connections, we think is going to allow us to have some really profound impacts. And maybe I'll just touch on a couple of the examples of the types of things we're talking about. But at the outset, there probably are critical short-term needs that we will see and move on. Hunger is obviously one that comes up fast, and of course our healthcare community is in urgent need of support. But let me, if you wouldn't, Anna, could you switch to the next flip to the next slide? So just, we're thinking in terms of priorities. You see here with the pyramid of number one goal would be to stop the spread. Anything we can do to support and help that, of course, will reduce the problems later. The second priority here is support the healthcare community. Again, if we can delay and help our healthcare providers not get overburdened, we will, touch so many lives in such an important way. And then support our vulnerable segments, and finally rebuild. And I put this up because it's the lens through which we think about the problem, but we're not operating sequentially. When we see a really important opportunity to have an outsized impact, we're going to try to move on it. And as we build our resources, the more resources we have, the greater impact we'll be able to have. But examples that we've been working on are, for instance, in terms of trying to stop the spread and encourage social distancing, we looked at the testing sites and we thought about, can we get boxes of food that would, 40 meal family packs, so that perhaps we could coordinate with the county health officers to register the people who are doing the drive-through testing, and put in their trunks a box of food so that they could stay home and, and promote social distancing. As an example, I use that because in coordinating with the food banks, there is the food available, to provide there. And so what this really required was thinking about it and coordinating with the test sites. And it's actually, in this case, maybe very low cost, something, a project that can be accomplished. However, we all know this is a very fast evolving and, information changes quickly. And the test sites, as of today, as we were looking to try to action this, said that they are moving, possibly, we anticipate, moving to a fast test, a quick test that will now be administered in doctor's offices and not the drive-throughs. Now, I don't know if that's going to end up being accurate, but it would change that, intervention, if you will. The other thought, so staying in touch and being on top of it as this moves, I think is something that we'll want to be able, and we think we'll do a nice job of being nimble, but really. Early. Sorry, just a second. Apologies. That we will see those things really early and clearly. The other idea that extends from that, though, would be, could we deliver food to COVID positive patients in concentrated areas, for starters? And of course, that's a different logistics challenge, because it really does, it's not just the food, and it's spread out so far, it becomes a transportation and delivery issue. And again, we think we could, as we look at that, bring in other partners, and then perhaps actually invest to make that happen. Other examples are, talking to the Department of Education, and which we are, to look at how many children don't have computers, and where are they, and how many don't have connectivity. And we see urgency to helping that, but of course there are many people involved who might already be willing to partner to either donate computers or Wi-Fi, and there are other organizations who may already have been looking at this. So as an example, that's something we would, as we're looking at it, raise the flag, look for partners to join us in that, but take the lead if that's the logical place for us. The other thing, which we are, there's some high-tech and low-tech solutions to problems, and on healthcare, we know that our providers can, the healthcare providers are exhausted and could use food, childcare, and housing that allows them to, stay close to where they're working. And so again, those are logical projects that we would look to partner with other people with. So I think what I'd leave everyone with is, we love your support to help us in this mission. But as, if not more important, is sharing sharing the gaps that you see as they emerge. I think that's where we will able to be most effective in partnering, and that's already happening actually with a number of you already on the call. But we look forward to doing more of that and to try to showcase the things where we are getting traction and sharing best practice so that others can follow that, if you will, and also learn from what others are doing that we could borrow from. Let me pause there, and maybe I'll pass it back to Hans, and then we can entertain questions.
Thanks, Josh. Can we, Anna, go to the last slide? So, Josh just articulated this first bullet point, which is we genuinely want to be part of the community that's sharing information and talking about what the gaps and the needs are in the community. Obviously, we welcome funding for our effort and for folks that are more locally focused for the other locally focused efforts. Someone did the math, and if we raised collectively $100 million, that's $11 per person in the state. And so it just goes to the scale of what we're trying to do. And so I'm sure, like you guys at the Community Foundation, we're trying to think about how we deploy our resources in an extraordinary way to be helpful. And a lot of the folks that are talking about participating in the fund are also thinking about how do we really change and I don't want to say step up, but think about how we respond collectively as a philanthropic community. Lastly, this isn't my world, but you can follow us on Twitter and Instagram and Facebook. And I don't know if this has been enacted yet, but there's some, if you give a little bit of money online, you'll get and talk about it on Twitter, Bruce Springsteen or someone will send a thank you video to you. I'm not sure that's happening yet, but that's one of the things we're working on. So we would love people to join us on social media and well as communicate with us directly. And that's, I think, Anna, that's sort of the end of the formal part of what we have.
Thank you. Maria, I'll turn it back over to you.
So now we're open for questions from our participants. Do we have any questions online, or is anybody ready to ask questions? Do we have anything on the chat box?
I don't see anything on the chat box now, but that's just a reminder to folks, if you have a question, you can put it in the chat box or you can unmute yourself. To unmute yourself on the phone, you can press *6. And to unmute yourself on the computer, you can just press the microphone icon on the bottom of your screen.
So, hi, can you hear me?
Yes.
This is Marsha Atkins at the Healthcare Foundation of New Jersey. Josh was talking about the need to find housing for some healthcare workers so that they're safe and don't have to travel maybe so far to get home. The Healthcare Foundation just gave a grant to University Hospital to buy air mattresses, toiletries, food, and whatever, so that some of their healthcare staff can stay in the hospital in places set aside for them to help them. So that's just an idea that may be a less expensive way to accomplish your goal.
That's great, Marsha. Thank you.
You're welcome.
And we have a question in the chat. I have, how can we send you the needs we are seeing emerge?
So if you go to we should have probably mentioned the website up front. We have a website, www.njprf.org. There's an email link there, and we have a colleague that's monitoring those emails and forwarding them to the right place. So we're welcome to take them there, or we're open here. We're available here at the Community Foundation. And so you can give us a call here, and either I or someone will get back to you, and we can learn what you're seeing.
Okay, great. I have another one. Are you surveying
Hans?
foundations? Oh, sorry.
No, sorry, it's Bill Engel. Hans, could you go into a little more elaboration with Josh of how you're going to coordinate with the different regional funds?
I think we're going to have, I don't want to make it too fancy, Bill. I think we're just going to try to have as many conversations as we can. But I think, understanding what their grant making priorities are, what needs they're seeing in their local community, as well as our priorities emerge, is the mix we're looking at.
Yeah, just to reinforce that, one of the most valuable things we're doing now is sharing as we're hearing ideas and what people are doing and seeing what we think we can latch onto and anticipating things and putting them out there. So I agree with Hans. It's far from a perfect science, but it's great. People really are sharing ideas, and there's a lot of good ones out there.
Also,
Thanks.
Bill, this is Maria. Let me just add to that, and Hans mentioned it before. We're trying at CNJG to organize a conference call with all the funds that are currently, well, by the time we have that call, there may be another one, but we are trying to pull everybody together so we can sort of look at and maybe develop some kind of a grid that shows where the needs are, so we can hopefully do more coordinated work. And one of our reasons for doing that is also concerned that we not have all the resources go into one space and not have enough resources to deal with the long-term needs, as well as making sure that we look at all of this in a bigger picture. I also want to say that one of the other things we're doing at CNJG is we have, and Craig has been putting that message out, we are working with Candid, which is the merger of GuideStar and Foundation Center, to use their Get on the Map software to have our members put into their system the resources where they're giving grants to and how they're distributing their money. And we want to, from that, develop a map that'll show people, will show us all as funders where the resources are going, so we can also see where there's gaps. So hopefully that'll be helpful to the pandemic relief fund that we're talking about today, but also for everybody else, so that we use our resources well. I can tell you that one of my concerns talking to a member today is the fact that one of the things that people have been promised now, and I'm thinking about the government piece of resources, is the Paycheck Protection Plan, which is supposed to keep agencies whole if they apply through that to be able to keep their employees on the payroll. Well, it's turning out, and we'll see what happens in the next day or two, a lot of banks do not want to participate. And so that's an issue I guess we're going to have to look at, because that's going to have a tremendous impact on keeping agencies open. And what is that going to mean? I know that's not part of the conversation today, but that's really concerned me, that we have a lot of banks in this area and we are all clients of those banks, and that they need to also step up. So maybe there's something the state fund can do to help advance that particular situation.
Could I also add that one thing goes on the work that we've been doing the last year? As we're doing all of this work with our grantees and other people, remind people to fill out their census form, because that'll be long-term, more money will come to New Jersey.
Amen, Bill. Amen. And I think this isn't a pandemic relief fund comment, it's a community foundation comment, but I just remember with Sandy articulating finding a space where you can really make it. I mean, we always try to do this, all of us, with our grant making traditionally, but I think in these crisis times, it's even more important, which is articulating what our objectives are, where we think we can have an impact in deploying resources in those spaces. And the panoply of needs is so overwhelming that it's hard to prioritize sometimes.
Great. Thank you. I have a couple more questions in the chat. One is, are you surveying foundations and funders to see what has already been funded, such as Computers for Youth?
So I will say we're putting out various surveys, and we are connecting, and you're saying specifically on the computers, that I don't know the answer to. We've been talking, as I said, Department of Education, and we are in touch with a handful of folks who we know have computers that might consider donating them, but I don't think we've taken this yet to the level of broadening that. We are doing that in other areas, and that's a work in progress. We're doing that a little bit in healthcare. It's some of the needs, and also in some of the agencies in the food distribution network.
Maria, do you think that's a role the council could play, is to gather some of the, as you said earlier, sort of the activities that are going on?
Is she on mute, maybe?
I'm going to take that as a yes.
So I'll
I'm
answer
sorry,
that.
I'm
Okay.
sorry, I just realized I was on mute. I'm sorry. So I'll answer that. So we have a couple of ways we're trying to work on that. We're partnering with the Center for Nonprofits to send out surveys. We had one go out, and there's one that's out now that is due tomorrow, to keep us up to date with what the needs are that they're getting from the community, as one way of being able to gauge that information. So that's one piece of it. The other piece is that that mapping that I talked about earlier, is another way of getting information of where the particular needs are. But yeah, we're trying as much as possible to sort of serve as leveraging our position to convene and collect information.
Great. So, Josh, you also mentioned healthcare. So I'm going to ask this other question from the chat, which is, how is the fund connecting to the needs of the New Jersey disability community?
I don't have any specific initiative there yet. In fact, we have very few specific initiatives yet, as Hans said, with 2 to 3 weeks in. So I don't have nothing I can tell you right now about that.
Thank you.
Mm-hmm.
Could I just add something to that? I know Kevin's probably not on this call. He's probably busy running around all over Newark. But
I'm
one of
on.
the things, who's on?
I am on. This is Kevin.
Oh, you on? Okay. So could you talk a little bit about what the funders were talking, because that became a major issue in last week's funders meeting. So how were they responding?
Just generally, how are funders responding in Newark?
Around the issue of the some of the health needs.
Yeah, so that's really something that we're continuing to explore. Obviously, the needs are so vast that it's really hard for foundations or a funding community to get their arms around. So, what I've seen in Newark is that we have some organizations, universities, et cetera, trying to chip in. For instance, NJIT is making face shields. Our local Anheuser-Busch plant is doing hand sanitizer. And I know a lot of that is tied in with the statewide efforts as well. And then really most of the focus has been on basic needs and food insecurity and items like that. We are trying to get a handle on the kind of PPE needs that our hospitals have. We know that our 5 hospitals are all running short, but it is a huge lift and a big expense. And to Hans' point earlier, seems a little daunting for philanthropy. So we've really focused so far on more of the basic needs items than health products or PPE or things like that, and really trying to do that more in partnership with other organizations or institutions.
Mhm. I know that Robert Wood Johnson is going to be coming out in the next day or two with their a communication about how they're going to respond to COVID-19. But in our conversation with the director of the New Jersey efforts last week, yeah, it was last week. Today's only Monday. One of the things that was talked about is that they're going to be providing a certain amount of money to each one of the funds that exist, including the one we're speaking with today. And so that may be an opportunity to look at some of those resources to address some of the, I would think, health issues because of Robert Wood Johnson's interest in that area, in that space. Anna, you want to go to the other questions?
Sure, yeah. If Hans and Josh don't mind continuing answering questions, I have more from the chat. I have this one, which we touched on a little bit already, but maybe we could expand on it. It's, how are you linking to groups of community foundations that may not have worked together before, and who are working to meet needs?
Well, I think I included them in the community of folks that are mounting quote unquote local relief efforts. So I'm hoping that they'll be part of those conversations. And I'm well connected to our colleagues, mostly in New Jersey. And then, we have good connections, I think, amongst all of us with what's going on in other states.
Yeah, actually, that's a good thing we didn't mention. McKinsey has generously offered a significant team effort to contributed to New Jersey Pandemic Relief Fund, and so we get great information in terms of best practices in other state communities and actually other countries, which is another way that when we hear good ideas, we could share them and pass those along.
Great, thank you. I also have another question from the chat. Can you say more about your process and the timing you envision?
Yeah, I will. We spent a fair amount of time on talking about fairly rigorous, process and rubric and decision-making and prioritization. And what grew out of that was that complex pyramid that you're looking at, you looked at a few minutes ago. The events are moving fast, and so we really don't want to pretend to have more precision than the situation merits. And I think over time, we really do have this notion of we want to look at what is our impact per dollar and how can we do, put resource and connect it with problem or opportunity. But in the short run, there are common sense, just real needs that just leverage what we're doing, and we're going to do them. And we also think in terms of this is going to be with us for quite some time, as we all know. So we do need to keep resources in mind to combat this as it evolves, and that's certainly in our thinking. And then in parallel, people still are working on decision-making criteria that we will have to decide. How do we size any intervention and prioritize it. But that's a rich work in progress, is what I would call it. And I'm happy with that. I think right now common sense is worth a lot.
Thank you. I also have a question can you provide some examples of Sandy relief efforts that might be relevant to this?
Well, yeah, the Community Foundation and Dodge and other philanthropies partnered on a recovery fund. And then if folks recall, the governor and the first lady, Christie, at that time did their own relief fund. So the structure is a little different. On the recovery side, there were, I think, a number of really wonderful grants. But a couple that stuck in my mind were dollars that, for lack of a better description, I would call advocacy dollars that helped vulnerable and underserved communities access the federal relief funds. And if anyone, I think Kathy Durante is on this call, but getting access to those dollars for people that don't have a lot of resources or time is extremely challenging. And so the grants that we made that at one point, I think even almost litigated with the state and the feds on the way those dollars were flowing, to me, were some of the best money we spent in that environment.
Thank you. And if we have time for just one more quick question, there's a lot coming in from the chat, but I have, how much has been raised thus far? Do you have an estimate?
Not enough. How's that for a quick answer? So, yeah, I think we're in what we're calling the silent phase, and we're talking to a number. We have a number of commitments, and we're talking to folks about future commitments. And I think we're going to try to kind of garner a first round of commitments and then make a public announcement. And so I don't know whether that'll be later this week or next week. We're pedaling hard to get this sort of first round of fundraising completed.
Thank you. And I won't keep you here forever answering questions. If anyone has any other questions, they can certainly send them our way. But Maria, I don't know if you want to get started with moving on to the discussion.
Let me get off mute. So as far as the discussion, why don't we look at where we think we want to go from this point forward? This was great information today. There's a couple of things that we want to make sure folks link on to beyond this, and that's one that we ask, and also I hope, Hans, you look at it as well. We want to see we'd like to encourage all our members to sign the call for action pledge that has been presented by the Council of Foundations. So please go back and look at that. We have it online, and we're using that as a vehicle to get as many of our foundations to sign up on that. If you look at it, it really touches on all the kind of work that we'd like to see happen in New Jersey, including equitable distribution of resources during this time. So if you can sign that, that would be wonderful. The other piece is having the area for the mapping piece that I think is going to be very critical for us to get your support and effort into. So at this point, the funded discussion, can we open it up, Anna?
Yep. And anyone who has a, again, question or something that they want to share with the group, something that their organization is doing, thoughts on coordination. We talked a lot about coordination today. They can either type it in the chat and I can read it out loud, or please feel free to unmute yourself. Again, unmute on the phone is *6, or you can unmute pressing the icon, the microphone icon on the bottom of your screen. And I actually see that Susan Hoskins has raised her hand. So Susan, I just unmuted you if you want to share.
Thanks. I was just wondering, as these things evolve, and I'm really happy to hear about the collaborative focus of the foundations working together. It seems to me that there's always things that fall through the cracks, but they're the things you don't hear about as much, or the needs of small organizations. So, you know, right now we're all acutely aware of the need for PPE. But if in fact there are PPE or funding for gloves and masks and ventilators coming through a different pipeline, then it would be helpful to know that, so that, and to be identify, like share information about what are the things that are falling through the gaps that nobody seems to be funding.
Also, Marianne McLean had a email she sent to us from United Way of Monmouth and Ocean County. If Marianne, if you're still on, Lorianne, if you're still on, do you want to make a comment?
Oh, thank you. It's Lori. We had launched last week our COVID-19 recovery fund. We took a little time before we're launching because we work with a lot of agency partners, and we wanted to make sure we knew their ability to work virtually right now. We have all of our financial success centers converting to virtual access. So that is really where our fund is about. It's about now and in months to come and years ahead, and how we can help with the financial issues that people are currently undergoing and will be in the later on. Thank you for letting me share that. Thank you.
Could somebody just explain the difference between the funding that's coming through this fund and the funding that's coming through the community funders of South Jersey? Is it area focused? South Jersey does South Jersey and this does everything else?
Andy?
Yeah, I can hear you.
Yep. So
Yeah.
our South Jersey fund is obviously targeted at the southern 8 counties because of our close working relationship with Hans and the team at CFNJ. We'll be working very collaboratively and trying to understand what the statewide pandemic fund is trying to do, and as much as possible bring resources that are raised statewide into South Jersey through our fund. But it's 2 separate funds, but as many folks on the call know, we have a really close back office working relationship with CFNJ.
Right.
So Hans, do you want to elaborate on that?
I think you said it nicely.
Okay. So the question is again, will any of your funds, Hans, not your funds, but
Right.
those funds hit South Jersey?
Yes. I think, as Andy said, in coordination, we hope, but yes, I think we want to touch lots of places in the state.
Okay.
So this is Maria again. I can't emphasize enough, from the kind of questions I'm hearing, how important it's going to be for people to filter their information or funnel their information to that portal that we've set up online, because we'll be able to get a clear picture of where money is going. So on a regular basis, we can have a conversation about where the gaps are and where and try to address them.
I have something in the chat as well, a note that says, through the NJVOAD, the New Jersey Volunteer Organizations Active in Disasters, we heard that we need to collect all that we are donating / providing to be best prepared to get a 75% match to our 25% match from the federal government. Can anyone elaborate on this to make sure we all understand? Does anyone have more insight on that or can elaborate on that?
One of the things I realize is that we need to have a session as well, because even though this is the initiative we're talking about today was launched by the First Lady, we need to talk, and I think next week we're going to have a representative from the governor's office. Am I right, Anna? Is going to be on our call. Huh?
Yes, April 13th, Monday.
That's next week, right? That's next Monday, right?
Yes, correct.
Okay, so one of the things we need to get straight with that, from that entity, is how they're going to manage these resources coming from the state, from the federal government. Because I said, as I was saying earlier, one of the concerns already is that people are trying to deal with the paycheck protection plan. And already what I'm hearing from a lot of nonprofits is that many of the banks either are not participating in that, and it has to be done through a bank, or very few do, and they're now saying that they're limiting, number one, how much they're going to limit their ceiling to get involved in it. And number two, some of them are saying, if they're not if they haven't been customers, they're not going to get involved in that process. That is a dire issue for our people, and even all of us, and even for all of us in this area. So we need to have those kind of conversations next week for sure, and try to address them in a way that gets answers.
Hi, Maria, this is Marsha Atkins. I'm getting very concerned because there are so many conference calls and so many surveys out there, and they take an inordinate amount of time. And I have to tell you that just the Healthcare Foundation, for the request for proposals for emergency funding that we put out only to our grantees, has gotten just under 40 requests for funding. We've already processed half of them, more than half of them, but it's a huge amount of work. So I think there has to be real coordination and a limit to the number of calls and surveys that there are. It's very important. I'm not negating the importance of the calls and surveys, but I think there has to be some coordination among conveners and not repetition.
I hear you, and I appreciate that, because I have seen way too many surveys going out. And we were hoping to cut some of that by having the surveys we coordinated with the Center for Nonprofits, but you can never stop people from doing their own surveys. But hopefully we can get a handle on that. Thank you, Marsha.
Okay.
Is there any more questions or discussions at this point?
There is another question in the chat. They said, and this is for the group, I heard that hospitals in South Jersey are treating coronavirus patients in the ICU, but they're not being reported because they're not being tested. There are not enough test kits for those. But that is just hearsay. Does anyone know more about that?
That sounds like a question we need to ask some of the nonprofits working in that area. So perhaps Andy could find out more information.
It's 5 o'clock.
I'm sorry, that was my Mac that lets me know, keep me on schedule. Perhaps that's information we can get, but also we should touch base with Linda Zippo and see what she's hearing. Now her report's gonna be probably coming out tomorrow, and we'll have more information. And we are all, I have to say, as we kind of close this out, because it sounds like people are pretty much done with having any more conversation, we have to recognize that we are dealing with an invisible enemy and trying to fight a war with something we are not totally, but as much as possible, passionate about changing and dealing with. So let's all continue to support each other. Let's continue to communicate, and we'll figure this out together. We will have another session next Monday. Hopefully we'll get more answers, and send us any text that you send us, we'll follow up on, because we realize that it's always important to be communicating and knowing information. So thank you for your participation. Is that pretty much it for us tonight, Anna? Will you allow us to will you let us go?
Yes, it's 5 o'clock. I think that we're allowed to sign off.
Okay. Thank you everyone for your participation. Thank you to Josh and Hans for your time today. Hopefully it has been worth your time, but also I look forward to more conversations with you as we figure out how to best coordinate the work that we're doing.
Thank you, Maria.
Thank you.